Hi there, welcome to the Birth and Women's Health Center here in Yoder. We are a nonprofit organization started by 10 Amish and Mennonite churches back in 2004. So Lois and I are the certified nurse midwives that practice here, and I hope you guys made it to Yoder okay. This is our waiting room, set up just like most OB/GYN offices. This is Lois and I's exam room here. We are the two certified nurse midwives that catch babies here at the birth center. And we take turns catching babies, and we take turns doing the visits. So usually the goal is to have your return OB visit with one of us one time, and then the next month the other, so that you get to know us both, because one of us will be here with you in labor and plan to catch the baby, and then the other one gets called in for the delivery, so that we're both here for the birth of the baby, and then the one has not been up all night long will stay and do the postpartum time. This is our lab. We're a CLIA-waived lab. We do all of our lab work here. You don't have to go to any kind of lab one or anything to do your lab work. We have a courier system out of Wichita, so anytime we draw blood here, we will call the courier and let them know that we have a specimen to pick up. They come every day across western Kansas to the small hospitals and clinics and pick up any specimens, and then take them back to Wichita and then mail us the results, email or fax them, one of the two. So when we get the fax the results, then we call patients if there's a concern, or they go in the chart as everything's cool. This is our bathroom here. The bathroom, we like for our patients to participate in their care. One of the ways we like to do that is we like for you to check your own urine. So we teach you how to dip your own urine and look for protein and glucose. Another thing that we do is this scale right here. It's not too complicated, but it's a little bit different than maybe the normal home scale. So we teach patients how to check your own weight. So then after you get here, you check your weight, check your urine, and have a seat in the waiting room, and then we call you back into the room and get report on how your urine's looking and how your weight is. This is our educational room here. Most of our patients use this room for the breastfeeding postpartum more than anything, and also the toy box. Lots of toddlers like to play in here. We have library here. If patients want to check out some books, they get to check them out and just write them down, and then when they're done with them, just return them. It's on the honor system. In here is our kitchen family room. Like I said, we like for our moms to make themselves at home when they're here in labor. So you get to eat and drink whatever you're craving. We don't want to force feed you or anything, but if you're craving lasagna, you get to bring it and make it. We have basic things like apple juice and 7-Up and frozen biscuits for after the baby comes for breakfast. But if you're wanting something else, you're welcome to do it. We don't routinely do IVs unless there's a concern like you just can't quit throwing up or you have a positive Group B strep test. Otherwise, we don't routinely do an IV. So we want you to stay up on your oral hydration and eating while you're in labor so that you stay on your energy, keep up your energy and strength. The next room here is our nurses station. This is where we do our documentation. Also has double lockbox for narcotic pain relief. Most of our patients try not to get pain medicine, but if you need it, we have it here. In the back here is where we do non-stress tests. If someone were to go overdue or the baby wasn't moving right, or there was a concern, we could do a non-stress test here. You don't have to go to the hospital to have that done. We don't, however, use it. This is what it looks like. You've probably seen it before in the hospital. But you get strapped up, these little bands that listen to the heartbeat. If there is a concern though in labor, we don't do this. We go to the hospital. We don't want to take any chances. If we have a concern with the baby, we want to be someplace safer where there's more access to continuous fetal monitoring. So this is really just for if the baby's not moving right, or if you need non-stress tests because you've gone overdue or something like that. Also, you can see the bed off to the side. That's where Lois and I get to rest here if we've been up late night with somebody in labor. So we have 2 labor and delivery rooms. Both of them are set up pretty much the same. This is called the Rose Room. It's got a standard double bed. We like for everybody to make themselves at home and comfortable when they're here. So on the hands and knees is common, but most people don't spend much time in the bed. We like for you to be up and around. That's best for you and best for the baby. The more you move around, the more that baby's head can get down into a bony pelvis and find its way out correctly. So lots of hands and knees, lots of walking. You can sit in the recliner, whatever. This is our bassinet. We are required to have this by the Kansas Department of Health and Environment. We're licensed by the KDHE, and because of that, they have us, crossing all of our T's and dotting all of our I's, and one of those requirements is the bassinet. However, we do not believe in put babies in the bassinet. We want babies to stay with mamas and daddies at all times. So as soon as the baby comes out, baby goes right up on mama's tummy, and we do everything we need to do from that position. So this gets used for our paperwork, actually. These are our cabinets here. This has got some equipment for maternal emergencies and things like oxygen tank and an emergency board, and the sharps containers in here. This cabinet's where mamas and daddies put their things, and in this one is where we keep our supplies like our birth kits and linens. We have linens here in case you don't want to get your own stuff messy, but if you want to wear your own t-shirt or your own gowns, that's totally cool. But birth is a bit of a messy process, so if you don't want to get your stuff all messy and have to clean it later, then you can wear our stuff too. So that's how that works. Oh, this is the Doppler. This is how we listen to the heartbeat and monitor the baby's well-being during labor. We listen before, during, and after contractions every 30 minutes while in active labor. And then once you move into second stage, which is the pushing stage, we usually listen more frequently, every 10 to 15 minutes. Of course, we do more often than that if we have any concern, if the baby's heart rate's going down at a time where we don't necessarily want to see it go down. Which at the end, when you're pushing, it does tend to go down pretty deep sometimes and then back up quickly depending on what's going on with that. So that's how that works. All right, and this room off to the side is your bathroom. Each labor and delivery room, of course, has a bathroom. This is our jacuzzi jet tub. It has jets, which is excellent for pain relief. We like for every patient to get in to the tub at some point during labor. It's great for pain relief. Also, we definitely want our first-time moms in the tub because that perineum stretches better when you've been in the water. It's totally cool. We don't routinely do an episiotomy. That's only for an emergency, which I think we've only done 3 episiotomies ever here at the birth center. So that's awesome. But in case we have a tear, which first-time moms have about a 50-50 chance of having laceration and needing stitches. So if we need to, we have the equipment to do that. We can sew things back together, but being in the water helps that perineum to stretch so that we don't have to do stitches, which makes for a lot easier on the postpartum recovery. This is our emergency entrance exit off to the side here. We have an agreement with the local EMS, so they know who we are and where we're at in case we need to call them. So they can, if we call and say, hey, we're here, we need a transport, they know who we are and where we're at, and they can come by and help us out there. We've had a couple, I think maybe 2 or 3, and the 2 that I can think of off the top of my head were for, they were breech, first-time moms, and all of a sudden the baby was in breech. So we had to call 911 and they were perfect about helping us out there. This cabinet keeps our radiant warmer. This is another one of the requirements by KDHE, so we have it here. It doesn't get out of the cabinet that often, maybe a few times a year do we wheel it out into the hall and get it ready. It has full resuscitation capabilities with the oxygen tank, the neonatal mask, pulse oximetry, and suction equipment. So it helps us get ready for if we're considering that we might have to do some newborn resuscitation, we like to get it ready. So we bring it into the hall, and if we're pretty sure we're gonna have to do some resuscitation of the newborn, we bring it into the room. So research says about 10% of babies are gonna need a little bit of help, so we like to be ready for that. All of us here for the birth, which is the 2 certified nurse midwives, and all 3 of our registered nurses are required to have NRP, which is the newborn resuscitation training. So we're all ready in case we need it. So everybody here is ready to help. This is our other labor and delivery room. It's the blue room. It's set up exactly the same as the other with the standard double bed that most people don't spend a lot of time in, hopefully. We like for people to be up and around. This bathroom is exactly the same. It's the same corner jacuzzi jet tub as the other room. So, and then of course the bassinet is here. One of the things that we have in this room, which can be moved of course, but we like to show you that we have the Kea birthing stool. Some patients are into the squatting stool. This is kind of the cool designed birthing stool right now, usually like this. And the midwife is down in front and daddy is often behind. We do let daddies help catch babies if they want to, but this is not usually the best position because mama kind of likes to lean back sometimes. So, but anyway, this is a great squatting stool if you like it. It's great for pushing. It's good using gravity to bring that head down. So if we're needing to bring the head down, this is a good position to be in. But most of the time it's pretty intense. Most of our mamas that sit down on the squatting stool feel like, wow, this is way intense pressure. Let's get off of this thing quick. But some of them love it. So we like to try things and then we do whatever works best for you because nobody's the same as everybody else. So we all are individuals. So let's go on into the next room. It's the utility room. This is our soiled utility room. So we clean our instruments and our linens and things in here, and then we pass them through to this side. This is the clean utility side. So this is our autoclave, how we sterilize our instruments after they've been washed. And this is our medication cart. It gets wheeled into the room with every birth. It has the vitamin K shot and the eye ointment for the baby. Also has the IVs and the suturing equipment. And in case we were to have a postpartum hemorrhage, we have Pitocin. That's our first line. And of course, we do not use that in labor, although if you need Pitocin in labor, we need to be in the hospital for that. We don't ever use that in labor, but we do have it here in case we have a postpartum hemorrhage. We also have Methergin, but it's in the refrigerator in the laboratory. And in this cart, we also have the Cytotec, which can be given rectally. So those are our options for postpartum hemorrhages. So That gets into the room every time, and hopefully we don't need anything out of it, except for, of course, the newborn eye ointment and the vitamin K shot. We do allow you to decline any of those things you like. If you've researched it and have concerns, we can go over that and have you sign a paper saying you don't want to do any of those things. So also has the IV equipment, so that if we have antibiotics, sometimes if you have group B strep positive, you'll need IV antibiotics in labor, unless of course you want to decline that, which most of ours don't, but occasionally we have somebody that wants to decline that. So I think we as certified nurse midwives believe that labor and delivery is a natural part of life. When you're pregnant, you're not ill, you're just pregnant. And so this is a natural, exciting time. So we want to allow your body to do what you're made to do without any help. So we do our testing and our monitoring to make sure that you and the baby are staying safe, maybe not doing it exactly the way everybody else does or the way most people do, but you do it your own way, and as long as you guys are both safe, then we're good with that. We're going to keep our hands off. So one of my instructors in my graduate program said that the art of midwifery is doing nothing and doing it well. So that's our goal, to let you do what you're made to do and keep our hands off, and then intervene when necessary. So I hope you guys have appreciated this tour and it's been helpful, and give us a call and we'll give you a live tour if you like, and we'd love to hear from you. Take care. Thanks.